February is American Heart Month, and we've kept an intense focus on what we can all do to take better care of our hearts, with cardiac arrest being highlighted following the one experienced by the NFL's Damar Hamlin. Idahoans may be wondering how they differ from heart attacks, what causes both, and what to do when they happen. Joining us to talk about this timely topic is Regent's Executive Medical Director, Dr. Daniel Meltzer. Dr. Meltzer, thanks for being here.
My pleasure. Good morning.
Good morning. All right, let's start with this. Can you just talk a little bit about the differences between a heart attack and cardiac arrest?
Yeah, people often confuse these terms, but they are distinctly different. We think of cardiac arrest as kind of an electrical problem, so much less common, much deadlier. And about 90% of people that have cardiac arrest don't survive. They frequently happen outside of the hospital, and so getting help immediately is critical. Heart attack, or what's known in the medical community as myocardial infarction, is really more of a circulation or a plumbing problem. Blood carrying oxygen to the heart is simply reduced or blocked due to constriction of the blood vessels.
Okay, electrical versus plumbing. That's a good way to look at that right there. Now let's focus a little bit more about the causes or contributors. That's the word I'm looking for between cardiac arrest and a heart attack. How about those?
Yeah, sure. So cardiac arrest, again, electrical problem, typically very abrupt, and malfunctions can be due, as we saw, to impact in the chest, as you mentioned, Damar Hamlin. Certain recreational drugs, illicit drugs, can do it, or innate electrical dysrhythms, or what we call dysrhythmias. Heart attacks, really, again, it's that narrowing of the pipes, if you will, with the blood vessels. Typically happens over time due to buildup of things like fat or cholesterol. People may have heard their doctors talk about atherosclerosis. And the contributors there really are chronic, over time, lifestyle choices, things like smoking, things like poor high-fat diet, things like obesity, recreational drugs even can cause a constriction of the blood vessels. So heart attacks typically over time, then presenting with pain. Cardiac arrests can be very abrupt, typically presenting with lack of cessation of the heart and therefore lack of movement and lack of consciousness and sudden dropping, as we saw in Damar Hamlin.
Okay, so I mean that's a good way to. I was going to ask right now, what about the symptoms? How do they differ? And obviously that's the big one there for cardiac arrest.
Yeah, again, cardiac arrest, sudden dysrhythmia or cessation of the heart beating. Patients will collapse, they'll lose their pulse, they'll stop breathing. They typically are not conscious. Heart attacks, again, tend to occur over time. People are familiar with chest pain or an elephant sitting on their chest pressure. It can cause jaw pain. It can cause shortness of breath, even things like nausea and vomiting.
Okay, gotcha. Now that we hopefully know the symptoms and maybe can recognize them not only potentially in ourselves, but in somebody else, what should we do if we are witness to somebody that might be experiencing one of these?
Yeah, these are emergencies. So, cardiac arrest, as we saw again in the NFL widely publicized case, starting CPR early is absolutely critical, just with our hands. So apply CPR, ask for help immediately. If there's an automated external defibrillator known as AEDs, which are pretty prevalent everywhere, even in gyms and restaurants and hotels, use them. It will walk people through how to use them in real time, very simply. With a heart attack, we may often have a little bit more time, but again, getting emergent care is critical. 911, going to your emergency department, often chewing on an aspirin if it's available can help. And again, if someone's unconscious, begin CPR immediately.
Okay, good tip there. Now, in closing, what would you say during Heart Month we should really keep at the top of our minds?
Yeah, look, there's been so much focus on the pandemic and on infectious disease lately, but let's not forget heart disease is the leading cause of death in our country. An American dies of a heart attack about every 40 seconds. So understanding that there are things we can do preventively, particularly when it comes to preventing heart attacks. So knowing our numbers, our blood pressures, our cholesterol, reducing weight, maintaining physical activity, stopping smoking, and as we've seen again recently, learn how to do CPR really can save a life.
It sure can. All right. And for anybody who wants more information on this or anything related, where can they go?
Yeah, heart.org is a really good website. The American Heart Association, often your local physician or provider group, or even your local health plan will have information.
Perfect. Joining me this morning has been Regent's Executive Medical Director, Dr. Daniel Meltzer. Dr. Meltzer, thanks as always for the great tips and for being here this morning.
Thank you.